do we really know as patients how active we're going to be capable of being, or how active we want to be? So given that so many people now are living to great old age and are becoming cognitively impaired or demented with it, as well as having all their different chronic diseases, their diabetes, hypertension, stroke disease, and so on, you have to think, does somebody have the capability, or will people, or will I, when I'm old, have the capability of being fully involved in my care? So having said that, I do think that we need to, as professionals, we need to help empower our patients, which is almost always done through a partnership. Clearly, looking after millions of people who are unable to care for themselves because they're demented and they've got advanced chronic diseases is going to be an enormous challenge, and having the kind of human resources to look after these people is going to be a massive challenge as well. You know, that's something the economist Baumol described and said, that actually you can't have the productivity gains within health that you have in industry, because fundamentally you need people. It still takes the same number of people to wash an elderly person that it took 100 years ago, and it will do in 30 years' time. So that's a great big problem. Illness in the old days was a pathogen or something attacking the body. Then it became something degenerative, the body breaking down. But it's now, illness is defined as having a risk factor for something, which pretty much includes everybody. I've got risk factors because of family history of diabetes, heart disease, dementia, stroke disease, and so on. So I've got risk factors. I've got a broken hand, which means I'm obviously ill. But it's that defining everybody as being in need of care because they are at risk, and hence everybody needs to be screened, scrutinised, caught by the sort of medical surveillance industry, whether it's by state or self-surveillance in the future. So I think my pessimistic view is that in the future, everybody will be treated as a sick person, and there will be sort of those people who choose to rebel or to fight back against that, but actually they will all be encompassed, and then the kind of medical industrial complex will sell us its products to monitor ourselves and to start treating these diseases before they actually happen. And we're already seeing this, and I think that's the direction we're moving in, which is frightening and scary. We've got almost to the limits of how long we can keep people alive, and then people have suddenly realised that that's not all it's cracked up to be, because the last years of life are incredibly disabled and for many people so unpleasant. So what can we think about in terms of quality of life, or what do patients want from their healthcare system? And I think these are really important questions, because I think what doctors want, the amelioration and treatment of risk factors, is not necessarily what patients want. But I think if we start asking these questions, you'll get so many different answers, it'll be quite hard to design a healthcare system around it.